Hi, this is Jean Hoban. I'm the Marketing Communications Director for Benjamin Rose Institute on Aging. Thank you for joining us today for helping a loved one navigate Medicare open enrollment. This program is the first in a series of virtual programs for caregivers that we will be providing on the first Wednesday of each month. This program is being recorded. We will be sharing the link with all of you in an email in the next couple of days. Please feel free to share that with family and friends who could not join us today. We have a lot of information to cover, so we will hold questions until after the presentation. However, you may submit a question at any time in the chat box located in the control panel on the right-hand side of your screen. Before I introduce our speaker, I'd like to tell you a little bit about Benjamin Rose. We are a Cleveland-based nonprofit founded in 1908. Our mission is to advance support for older adults and caregivers. We do that by providing a variety of services and supports to help people age well in the community, such as behavioral health services, an adult day program, and a telephone-based care coaching program called We Care. We also provide housing and financial counseling and coaching, as well as homebuyer education and a senior financial education program through our subsidiary Empowering and Strengthening Ohio's People, better known as ESOP. Our Rose Centers for Aging Well are our 7 senior center locations that are located throughout the Cleveland area, through which we are also a Meals on Wheels provider. For more information on any of our programs, services, and supports, you can visit benrose.org. And now I'd like to introduce today's presenter, Cynthia Walker, who is a benefits specialist and financial empowerment coach with ESOP, who will talk to you about open enrollment. Cynthia?
Thank you, Jean. Good afternoon, everyone. I'm here today to talk to you on Medicare Part D Financial Education Workshop Series for caregivers and how to help your loved ones through the open enrollment process. Before I get started, I do want to point out that we have a handout section over here that you would be able to download some very valuable information onto your computer or to print it out for your records. And one of the items in there is the Medicare 101 handbook. Next slide, Jean. So our objectives for today is to give you a basic overview of traditional Medicare, Medicare Advantage plans, and Medicaid, and as caregivers, how you can best assist your loved one in the upcoming Medicare Part D open enrollment season, which begins on October 15th and it ends on December 7th. And I just want to point out that the Medicare.gov site is open for you to review those plans now. And the changes that you make will take effect as of January 1st, 2021. And also to explain why it's important to review your Medicare Part D plan every year at open enrollment. Next slide. So as caregivers, I like to do a little thing with all my workshops, and this is from Rosalind Carter. Caregiving is universal. There's only 4 kinds of people in the world: those who have been caregivers, those who currently are caregivers, and those who will be caregivers, and those who will need caregivers. Next slide. So some terminology when you're going through this open enrollment process that you're going to run across and will be the annual enrollment period. And the acronym for that is AEP. PDA is Prescription Drug Plan. MA is Medicare Advantage. SEP is Special Enrollment Period. IEP is Initial Enrollment Period. And MSI is Medicare Supplemental Insurance. So these are some of the terminology that you're going to see in handouts and when you go onto the site. Next slide, please. So as a caregiver, how do you assist during Medicare Part D annual open enrollment? Number one, it's important to have a strong understanding of how Medicare works. 2, know the various benefits covered by the different plans so that you'll be in a better position to care for your loved ones' health needs. And 3, have your permissions in order. You can either get a verbal permission over the phone through customer service, and that permission will just be for that day for you to speak on your loved one's behalf, or you could fill out authorizations forms in advance. Next slide. So let's talk about Medicaid versus Medicare. Medicaid is funded by the state and federal government and is administered by the state. It varies from state to state and it serves people who are elderly, legally blind, disabled, as well as family, children, and pregnant women. Medicare, on the other hand, is a federal health plan administered by the Social Security Administration. It has the same rules throughout the nation. It serves people who are elderly, legally blind, or disabled. And with Medicare, most individuals will pay a monthly premium. Next slide. So Medicare. With Medicare, it can provide you with medical care and other services if you have limited income and resources. Each state sets its own program guidelines and decide what types of services will be provided. And there are many different types of services that they offer. Some of the most popular ones that they offer is the modified adjusted gross income, which is for parents, caretaker relatives, pregnant women, and individuals age 19 to 64. Then the categorically needy, blind, aged, and disabled. Those are individuals who are 65 and older, disabled or blind individuals. And then we have what we call the Medicare Premium Assistance Program. And this is for Medicare recipients that may not qualify for Medicaid as a whole, but there's still assistance for them out there, especially with paying for their premiums. And we'll talk about that. Next slide, please, Jean. So the Medicare Savings Program. This is a program that helps individuals with limited income and assets to pay for some part of their Medicare costs related to health care, more specifically their Part B premium, B as in boy. It also pays any late enrollment penalties that you may owe to Medicare because you did not sign up for, let's say, Medicare Part B at your initial enrollment period. Your state Medicare program works with Medicare to provide you with this assistance. So Medicare actually pays for your Part B premium to, let me correct that, Medicaid actually pays for your Part B premium to Medicare. And there are 4 types to this Medicare Savings Program. Next slide, please, Jean. And these are all income-based. So the most popular one is the QMB, which we call the Qualified Medicare Beneficiary. This plan pays for your Medicare premiums, Part A, if that applies to you, because Part A sometimes is not free to all individuals. It depends on your work credits. And Part B, deductibles, copays, and insurance. Okay. Then we have what is called Slim B, which is the Specified Low Income Medicare Beneficiary, and the Qualified Individual, which we call QI. This helps you pay just solely your Medicare Part B premium. Okay. And then the 4th one is the Qualified Disabled and Working Individual. This is for individuals who are under 65 and disabled, and they no longer qualify for free Medicare Part A because they have chose to go back into the workforce. So this program will pay for their Medicare Part A premium. Next slide, please, Jean. Medicare is a federal health insurance program administered by the Center for Medicare and Medicaid Services, also called CMS, for people who are age 65 and older, any age and disabled, or individual that's diagnosed with end-stage renal disease. If you receive anything in the mail in a yellow envelope and it has the initial CMS on it, it is not junk mail. You need to open it up and look at that. Next slide, please. So this is a breakdown of the Medicare program. You have two options. Option one is what we call traditional Medicare, where we have your Part A, your Part B. If you choose secondary insurance, which could be a group health insurance through your employer, uh, a supplemental Medicare program, which we also call Medigap, or if you qualify because of a low income, Medicaid, and then Part D, which is your prescription drug coverage. Option two is Medicare Advantage, where everything is all encompassed. So, Jean, next slide, please. To give you a brief overview of how these four parts work together. Medicare Part A is your hospitalization insurance. It covers your inpatient hospital care, skilled nursing home facility stays, hospice, and some aspects of your home health care. Part B is your doctor services and your outpatient services. This covers your doctor's appointment, outpatient care in a hospital session, such as going to the emergency room. So, if you're going to the emergency room, as long as you stay in that emergency room, this is going to be billed to Part B. Once you become admitted to the hospital, then that's a Part A charge. Some home health care, durable medical health equipment, and preventive screenings. Next slide, please, Jean. So, Medicare Part C, this is also called Medicare Advantage plans. These plans are sold by private insurance companies. These plans must offer at least the same level of coverage that Medicare Part A and B offers, but may also include prescription drug coverage, routine vision coverage, dental, and hearing benefits. When you enroll in a Medicare Advantage plan, the beneficiary continues to pay the Part B premium. However, he or she pays it to the private insurance provider. Next slide, please. And then we have our Medicare Part D. This is the prescription drug plan. It's offer prescription drug coverage to everyone with Medicare. You want to consider joining the Medicare plan, even if you don't currently take prescriptions, for these two reasons only. And I'm dealing with this right now with a client. You will pay a late enrollment period penalty if you join a plan late, and you will have to pay that penalty throughout your time of receiving um, Medicare Part D. And you'll have a waiting period before you have your coverage start. And what I mean by a waiting period, once open enrollment ends, and if you haven't um, joined onto a Medicare Part D plan, because you're healthy, you don't need medication or anything, but then 6 months down the road, you become ill, and now you're taking all these prescription drug medications, and it's costing you. It's not that you can't join a Medicare Part D plan. It's number one, you're going to suffer the penalty for not enrolling in your initial enrollment period. And number two, that plan won't take effect till the following year. Next slide, please. Okay. Now, there are two ways to get Medicare prescription coverage. You could get it through the Medicare prescription drug plan, which are called PDAs, and they add the coverage to your original Medicare, or you could get it through your Medicare Advantage plan, which operates either like a HMO or a PPO. Also, if you do choose to go with a Medicare Advantage plan, you don't have to have your Part D plan within Medicare Advantage. You could still have a standalone prescription drug plan. Now, what you can't have with the Medicare Advantage plan is that you can't have a supplemental insurance. Everything has to go through the Medicare Advantage plan. Next slide, please. So when can I join, switch, or drop a Medicare drug plan? You could do this when you first are eligible for Medicare. You have the opportunity to join during the 7-month initial period, which begins 3 months before you turn 65, the month of your birthday, and 3 months after you turn 65. If you get Medicare due to a disability, you can join during the 7-month period that begins 3 months before your 25th month of disability um, benefits. So if you're qualified disabled, you don't automatically get Medicare. You have to go without it for 25 months before you become eligible for it, and ends 3 months after your 25th month of being on disability. Um, you can also join, switch, or drop Medicare if something occurs that triggers what we call a special enrollment period. An example of that is, let's say an individual was dually eligible. Dually eligible means that you are receiving Medicare and you meet the qualifications of uh, Medicaid. So you are receiving both. Medicare is your primary, Medicaid is your secondary. However, when you come upon your recertification for Medicaid, it is determined that you're no longer eligible for Medicaid. That triggers what we call a special enrollment period for you, which allows you to go in to pick a new plan. Also, let's say you move outside of your provider area. That's another example that will trigger a special enrollment period. You can also join between October 5th and December 7th. The change, as I said earlier, the change will take effect January 1st, as long as you enroll by December 7th. And if you are on Medicaid and if you are receiving extra help, which we'll talk about, you get to switch, drop a plan, change, or join another plan once per quarter calendar year. Next slide. So that gives you 4 opportunities to switch your plan up. You could try it on. If you don't like it, switch to another one. So special enrollment periods generally must um, enroll for the calendar year, but you may be eligible to join, switch, or drop Medicare drug plans at other times. If you move out the service area, if you lose your credible drug prescription coverage, you live in a care facility like a nursing home, you have Medicaid or qualify for extra help. Next slide. So extra help, this is a plan that is offered through Social Security to help people with limited income and resources to cut the cost of their prescription drug medication. You could qualify for extra help, which is also called low income subsidy, um, if your yearly income and total resources fall below the limits. Oh, that should be 2021. So the limits for the coming year, 2021, for a single individual, if your monthly income is $1,615 a month or less, and you have total resources, and this is not including your home or your vehicle or anything like that, of less than $14,610, you would qualify for the extra help. If you're a married individual with a spouse and no dependents, and your monthly income is $2,175 or less a month, with total resources less than $29,160, you could qualify for extra help. And extra help comes in uh, 2 forms. You could get full extra help, which takes care of your deductibles, um, which takes care of the majority of your premium. Sometimes you may have to pay a small dollar amount for your premium, and it reduces your medication costs. Um, your generic prescription drug costs will be $3.60, and I believe name brand will be roughly around $7.68. You could also receive partial help. Okay, and with partial help, it will reduce your deductible amount to $89. Okay, and it will reduce your prescription drug costs down to generic for $3.60, And again, for name brands between $7.60 and $8. And what's also great about this, if you do have any penalty um, costs due to the fact that you didn't enroll in a prescription drug plan at your initial enrollment period, it will pay for that also. Next slide, please. So how to prepare for the conversation. Next slide. You want to begin by talking to the person and people who know that individual best. It's helpful for you to understand as much as possible so that in the event that you do have to act in their behalf, his or her behalf, you'll be comfortable doing so. So you want to speak with your loved ones, healthcare professionals, understand the condition of that person that you're caring for, ask clarifying and probing questions about his or her health care, and get information about screenings and treatment strategies that the doctors may be pursuing, and find out what the beneficiary's care and drug needs are and who has permission to act on his and her behalf. Next slide. You want to review their current coverage. Needs change and they may continue to change over time. So ask the beneficiary if the current plan will works for them. Is it covering all their health and drug needs for the next year? Um, is it still affordable to them? Um, look into other options. Is it worth switching to another plan? You want to consider your loved one's legal needs. If your loved one wishes you to make decisions on his or her behalf, consult with your OSHIP, uh, the State Health Insurance Assistance Program, to begin to the process of getting authorizations to make Medicare decisions for your loved one. Next slide, please. Keep accurate records. You want to keep track of your loved one's bills, appointments, and medications. This will help prevent any unnecessary complications in the event of clerical errors such as double billing. It does happen. So when you get those notices in the mail, open them up, go through them, make sure everything is accurate. It could also help you to stay up to date on preventive care so that your loved one has all the screenings and tests that he or her doctor think is necessary for them to have. Next slide. You want to keep track of bills and appointments and medication. Is this the same slide? The next slide, Jean. I think that's a duplicate side. Make a budget. Review your loved one's healthcare costs each month and weigh that against his or her income sources. Determine how your loved one and you can best pay for these health care expenses. And the reason I say that is sometimes medication, even though you have a Medicare Part D, um, it may be a high tier in the formulary, and it's really, really, really going to cost your loved one an awful lot to get it. Well, there are some state pharmaceutical programs out there. One, for example, is Ohio Best RX that may have that medication at a lower cost than what it would be getting it through their Part D. And also do a benefits check. This program looks for different resources and stuff in the area that can help cover some of your loved one's healthcare cost. Next slide. So what questions should be asked of the beneficiary? Are they happy with their doctors? What health concerns do they worry about? Are they up to date with their Medicare benefits? And would they like to make any coverage changes going forward? These are some of the probing questions that you want to ask them as you prepare to look at the various different options they have. Um, we asked about the doctors because if your loved one is in a Medicare Advantage plan, and or they're thinking about, or you feel that a Medicare Advantage plan would better suit them, because the Medicare Advantage plan have their own network of doctors. The HMOs, you have to use a doctor within their provider network. The PPOs in the Medicare Advantage plan allows you to go outside of the network. to see a doctor, but it's at a slightly higher cost. Next slide, please. Also, what questions should be asked concerning plan options? These are the things that you want to look at when you're looking at your Part D plan options: cost, coverage, convenience, and quality. Next slide. So when we're talking about cost, what you want to look at is what is the monthly premium. Monthly premiums, they varies in each one of these plans. You pay this fee in addition to your Medicare Part B premium assurance. In most cases, it's deducted from your Social Security check. You want to look at the yearly deductible. This is the amount you must pay before your drug plan begins to pay its share of your covered medications. Some drug plans don't have a deductible, or they have a very low deductible. And how that works: when a person has the standard yearly deductible for the plans is $455. So usually how that works, if you're on medication that is in a higher tier, until you pay that deductible amount of $455, Medicare does not kick in. So a lot of times individuals that take expensive medication, when they fill their prescriptions on January 1st, there is a large out of pocket expense for them at that initial refilling of all their medication. So you want to look at that. And when you look at the plan will tell you how much this individual will have to pay to fill all their prescriptions on January 1st. And it'll break it down for each month. After when they'll meet their deductible, um, if they're going to go into the coverage gap, how much they're going to have to pay, and so forth. Co-pays and co-insurance, these are the amounts you pay for each of your prescriptions after you pay the deductible. Most people pay a co-pay once they meet their deductible, whether your copay is $3.60 because you get extra help, or $10 because that's the standard copay because you're going to your preferred pharmacy. But you may switch over to co-insurance if you fall into the coverage gap. So now you're going from a copay to paying a percentage, and that percentage is usually 25% of the cost of your medication. Next slide, please. So here we are with the coverage gap, and it's also known as the donut hole. And you fall into that gap once your plan has paid $4,130 in covered medication coming into the year 2021. Now, one of the misunderstandings that most people have with this is not how much you paid for your medication, it's how much the plan. So it's the retail cost of your medication. So if you're taking a medication that costs, let's say, $600, but you're only paying $20 for that, the plan is, you combine those two, and that's what goes towards that $4,130. So if you are taking a high cost medication, it's easy to fall into that donut hole. Once you fall into that donut hole, you pay 25% of the plan cost for the covered brand name drugs and for the covered generic drugs until you reach the end of the coverage gap. Now, not everyone falls into the coverage gaps because a lot of people, their medication, when we talk about the formulary, takes tier 1 or tier 2 medication. So when you reach the end of the coverage gap, you're going to fall in what is called the catastrophic coverage. So you fall into that once you pay out of pocket for your medication $6,550. Now, I'm not talking about you, I'm talking about the cost, the retail cost. Once your retail costs get to that amount, then you're in what they call the catastrophic phase, and you're going to pay just a small co-insurance amount or copay for your medication for the rest of the year. Next slide, please. So, coverage, this is the formulary. This is the main reason why everyone who has a Part D plan regardless of whether you've been happy with this plan and you've had this plan for years, why you should at least go in and check out the plans. It is because of the formulary. The formulary is a list of drugs that the plan offer. It includes how much you pay for each drug. If the plan uses tiers, the formulary lists which drugs are in each tier. Formularies include both generic and brand name drugs, and in general, each drug plan formulary must include most types of drugs that people with Medicare use. However, each drug plan has its own formulary, so you want to check it out and make sure your medication is covered. Okay, so each year they do their formulary. And it's not that your medication may not be covered that you're taking with this plan, but it may have changed tiers. I'll give you an example. Albuterol. Albuterol was a medication that was just prescribed nationwide. It's a generic drug. And it was very cheap. It was the tier one. But this year, on most plans, albuterol is not being covered. Okay. You're better off going with the name brand because most plans do not cover this uh, generic brand of albuterol now, and it is running roughly between $500 to $600. So that means that if you're taking albuterol, um, you're going to have to pay that cost if it's not covered. Or the other option you would have is to have your doctor call the plan and see if they will make an exception for you. And they may make an exception for you, but you still might have to pay a hefty cost for it because even though they make it an exception, they may make it a high tier formulary for you. So you want to go in, you want to look at that list, you want to see where your medication falls at, what tier they fall in, um, if they have any limits on them or restrictions or need prior authorization. If everything is fine and you're okay with that plan, you don't have to do nothing and you'll roll back over into it. But it's always good to look at your other options, the other plans that are out there, to see what they have to offer if there's something better for you. Next slide. You also want to look at the coverage rules. Drug plans may require prior authorization, which means that they have to get permission to have this medication filled. You must show the plan that you meet a certain criteria for you to have this particular drug medication. Your doctor may need to provide additional information about you, why it's medically necessary. And that being, some medications, most drugs have a generic brand and a name brand. And there are situations where a generic brand just does not produce the results that the physician is looking for, but the name brand do. The name brand does produce the results. And they may have to get authorization from the provider to allow for their patient to take the name brand medication because the generic brand does not work for them. Plans also may require what we call a step therapy on certain drugs. This means that you must try one or more similar low cost drugs before the plan will cover the prescribed medication. Plans may also set quality limits on how much medication you can get. That just simply means that all medications aren't eligible for a 90-day refill. There are certain medications that you can only get a 30-day refill at a time. Next slide, please. So questions that should be asked concerning your plan options. The next one would be convenience. You want to make sure your current pharmacy is in the plan network, or that the pharmacies that are listed are convenient to you. Some drug plans charge lower copays or co-insurance amounts to particular pharmacies that are in the network. They have what they call their preferred pharmacies, And then they have what they call their standard pharmacies. And usually, when you go to the preferred pharmacy, your cost is lower than if you were to go to the standard pharmacy. Most plans offer a mail-in order program that will allow you to have your drugs sent directly to your home. And in most cases, that's where you're going to get your lowest cost at through the mail order system. Always consider the most cost efficient and convenient way to have your prescriptions filled. And even if you're not changing plans, make sure your pharmacy is still in your plan network for the coming year. Next slide, please. And then you want to look at the quality of the plan. Each plan has what is called a quality rating. Unless it's a brand new plan, there's not enough information out there for them to give a quality rating for the plan. Medicare uses the information from their member satisfaction survey plans and healthcare providers to give an overall performance star ratings to plans. A plan can get a rating between a 1 and a 5 star, and a 5 star rating is considered excellent. These ratings are listed in the Medicare Plan Finder at medicare.gov. Now, um, I have seen people who were on a 5 star plan, but their relationship with their customer service was so horrible, and it made this plan was probably the best plan for them, and they refused to sign up for it the next year. So, they have these star ratings, but it's really what your relationship is with their customer service. Are they available to you? Are they helpful? Are they courteous to you when you call? Next slide, please. So, getting the most out of your benefits. Things to consider when choosing Medicare drug coverage for your loved one. You want to take specific drugs, look at a drug plan that includes this medication on their formulary. Um, then compare the cost. When you call in for to review your drug plan, and especially when you call me, I do a comparison between the plans that suits your needs, and I'll send out a copy for your review so you can look at the cost, look at the restrictions and whatnot. So you want to take your time, and it's always best to look early, um, because there is a time frame for this. You have to make a decision by December 7th. So you could call now and just get the overview of the different plans that suits your needs, so you could sit down and meditate on them a little bit and decide which plan is yours, and then call back and say, A, I choose to stay with what I have, or B, I would like um, my loved one to switch over to this one. um, if you want extra protection from high prescription drug costs, you want to look at a plan that offer coverage in the coverage gap, and then check with those plans to make sure that they cover medication in the coverage gap. Okay, because sometimes these plans will not cover your medication in the coverage gap. You're going to end up paying the full cost. So if you have a high cost medication, you want to pay particular attention to that. Um, where you're at in the coverage gap and how much you're going to have to pay for that medication, because you may have to look at another plan, or you may have to go back to your doctor and see if there's another medication that will produce the same results, and then add it into your drug list and see how that affects your cost. So, and that, like I said, that gives you time to work on things, and making your decision when you go in early and do these things. You want the drug expense to be balanced throughout the year. You want to look at plans with no or low deductible, or with additional coverage in the gap. Next slide, please. If you take a lot of generic if you take a lot of generic prescriptions, you want to look at plans with tiers that charge nothing or low co-payments for generic prescriptions. You don't have many drug costs now, but you want coverage for peace of mind to avoid future penalties. Look at a plan with a low monthly premium for your drug coverage. And if you need prescriptions going forward in the future, all plans still must cover most drugs used by people in Medicare. Um, and like the extra benefits and lower costs available by getting health care and prescription drug coverage from one plan, you're willing to accept the plan's restrictions um, on what doctors, hospitals, and other healthcare providers can be used. Look at the Medicare Advantage plan. Okay, so if you're looking for extra benefits like vision, if you're looking for extra benefits like hearing, if you're looking for dental, if you're looking for extra benefits like what is it called, silver sneakers, or a stipend for over the counter medication and vitamins, you might want to look at the Medicare Advantage plan, because one of the draws to the Medicare Advantage plan is the extra perks that they offer with that. Okay, and the next slide, I think we open it up for any questions. So do we have any questions out here?
Thank you, Cynthia. Yes, we do have some questions. Our first question is, how do you get an authorization document?
You could go through OSHIP um, to get an authorization document. You can call the provider. But when you call the provider, you're going to have your loved one with you, because they're going to have to give them permission to speak on their behalf. And then you'll just ask the provider to mail out the authorization form, and you complete it and you send it in. Also, when you're on signing up for the new plan, there's a section on the plan that asks, do you give permission for the provider to speak to someone else on your behalf? And that's where you would put your name and your contact information in there.
Thank you.
And one thing I also said, if you have like power of attorney or document like that, just send a copy along, so they uh, to legitimately show that you have the right to work on this individual's behalf, especially if you have a medical power of attorney.
Thank you. Our next question, how long before retirement should you apply for Medicare if it is after the enrollment time?
You have a 7-month period from the point where you turn 65. Okay, so let's say you're turning 65. Let me get a middle of the month, in June. So you have the month of June, but you can start looking. Let's see, what's before June? May, April, March. You could start looking March 1st. So you could sign up for March 1st, and you have until 3 months after June. So that's July, August, September. So long as you have signed up and made your decision by then, because it is a big decision to make. And everyone who is eligible for Medicare, you are going to receive a welcome to Medicare packet. And because of COVID this year, they weren't able to do this. The OSHIP counselor goes out and they do welcome to Medicare, and they walk you through the process on what you need to do. And that's all that information you'll find in that handout for Medicare 101. You just call Social Security, sign up for your Social Security, and then you will go into Medicare.gov, or you could call an OSHIP counselor, which I am, and we could go in and set all that up for you. But you have 7 months to do that. 3 months before, 3 months after.
Thank you. Another question, how does a person qualify for partial help?
Because it is income based, um, partial help, we submit the application to Social Security. They have a little leeway there. So if you're like, it's a $25 leeway that they have on the limit for the single and the married individuals. So if you're slightly over, you would get that partial help.
Thank you. One question, what if someone is still working and getting insurance at work when they become 65? And this is our last question for the day.
If they're still working, they could, your employer will become your secondary. So you're not going to lose your employer's insurance. They'll just become your secondary.
Thank you. Well, I'm going to turn it back over to Jean to close out today's webinar.
Thanks, Jenny. And thank you all for joining us for today's program. Thank you, Cynthia. I didn't forward to the slides, so you can see Cynthia's information there if you need to reach out to her for additional information. And as I mentioned at the beginning, you will all be receiving a follow-up email in the next couple of days with a link to the recording of today's program. And I'm also going to include the handouts that Cynthia shared in case you missed them in the handout box. And I hope you will all join us next month for Difficult but Crucial Conversations, the second program in our series. That'll be November 4th at noon, and we will have sign-up information soon available, and that link will also be included in that email. So thank you all for joining us, and thank you, Cynthia, for providing us with that information. So that closes
You're welcome. Thank you all.
the webinar.